Could you introduce yourself, please?
Hello, my name is Julie. I'm a primary care navigator and also a healthcare assistant. I work at Oxford Terrace and Roland Road Medical Group in Gateshead.
My name's Jane and I'm also a healthcare assistant and primary care navigator working at Oxford Terrace and Roland Road Medical Group in Gateshead.
When we started the role as a primary care navigator 2 years ago, we felt quite lost and isolated. We needed to know a better understanding of long-term conditions. What we decided to do from the beginning was get out into the local community and introduce ourselves to local networks to see what was going on and what we could do to help our patients.
So what do we do for patients? Well, primarily we listen to patients. When we've listened to that patient, we then signpost them to whichever service they need. We also link in with carers, nursing homes and all the local groups around the area.
Social prescribing is all about connecting the patient to services that they need. It's absolutely amazing out there. There's so much to offer. You need to go out there, you need to find it, and you need to work alongside all these local communities. They're just absolutely fantastic, and most of it is free.
So where do we get our referrals from? Well, we do a 3-day discharge phone call. So patients who have been discharged from hospital, they receive a phone call from ourselves, just making sure they are alright from discharge and if they need anything from the GP. Other referrals come from GPs, other nursing staff, reception staff, and of course ourselves. In our role as healthcare assistants, we identify those patients that are needing help that maybe they don't think they need help. So they come in for routine bloods, and as you're talking to them, you find out a little bit more about what's going on in their lives at that time, and then we can identify them and point them in the right direction.
We'll have a dynamic directory of services. It's absolutely amazing. You need to build on this, get out there, get to know people and work with your locals such as Age UK, Gateshead Carers, Crossroads, and most important, our practice volunteers are absolutely great. They've got so much knowledge, they know what's going on, they keep up to date with patients. It's absolutely fantastic.
At the moment we also have a walking group going on, we have luncheon clubs, specifically men's clubs as well for those men who don't want to mix with the ladies of the community, and there's also lots of clubs and cafes going on in the area that are also free.
As we work with a lot of patients, one patient that sticks in our mind is about a patient called Jim. Just a quick brief outline of him. Basically, he was left his property by his parents, who had then died. He then had lost his job and become redundant, and therefore he started to get depressed. He was missing his family. Finances started to take a toll, and this had a major impact on Jim and his health.
It did, and first of all we linked Jim in with Citizens Advice Bureau first, which in first instance all they wanted him to do was sell his flat, which would make him homeless, which wasn't really the answer. So we started applying for various things, as in PIP, Personal Independence Payment. First of all was rejected for that, but we appealed with the help of Citizens Advice Bureau as well, and Jim was successful in this claim, which gave him a slightly better income per week. This then opened doors for Jim to apply for different benefits that he now gets, and he's much better off. His health's improved. We also got the green doctors out to see him, and they look at things like heating, energy supply, so we changed his energy supplier. He had his home landline taken out because he didn't use it, but he was paying that monthly charge. We also looked at the heating service that he had, making sure his radiators were at the right temperature. And now Jim's doing really well, his health has improved, his blood pressure is great, and he's doing well.
He also likes to go out and socialise now. He does go out to a lunch club, so therefore he's getting company of his own age and also people who are in the same position as Jim in the first place.
I think if we weren't involved with Jim, it was a slippery slope for Jim. He was going downhill fast, he lost a lot of weight. He actually couldn't afford to feed himself at that time. We did look into charities that were providing food parcels for Jim. This was the Salvation Army and one of the local churches. This went on for quite some time and Jim lost a lot of weight. Through our service, we have helped Jim get back on his feet. His finances are in better shape and his health is brilliant.
His mental health has also improved. He has now stimulation. He now has a good conversation. He no longer needs to go to the GP for antidepressants, and therefore he just knows that people are there to help him.
Thank you. That's